Hello and welcome, everyone. We are live for our second time today to add some valuable resources about the COVID-19 pandemic. As you can see on our screen, we have some amazing speakers and panelists that are going to come together in sort of a town hall meeting style live to start to answer questions, to build community, to talk about best practices, to really hear from the leaders in our industry what they're doing to implement changes and new policies during a time where we don't have everything figured out. So whether you're watching this live or in the replay up to this point, we want you to know that if you comment live, we're going to interact. We want you to know that if you comment in the replay, we will interact with that as well. So keep the comments coming. Let us know you're stopping by when you stop by, and we're going to get right into content today. So we're going to start introducing our guest panelists today. And first, we are going to start with Marcello. Marcello, me and you got to go live yesterday to kind of promote this, but really, why don't you go ahead and introduce yourself real quickly and talk about what you hope to add value to today.
Sure. Yeah. Thank you. And really appreciate you, Danny, taking the time to put this together. This is a very important topic, obviously, today, and things are moving so quickly. So it's great to be joined here with so many important people in our community. But my name is Marcello LaRocca. I'm one of the executive directors at Sandstone Care. And I'm hoping to just answer questions, provide perspectives and insights into how we're handling and adjusting what we do every day as an essential healthcare and behavioral healthcare provider, really across our continuum of care. And, really excited to hopefully get questions from people that are joining, questions from the other panelists that are here. And again, the goal to me is just really, things have moved so fast and we've all been required to make a lot of changes with less than perfect information. And so sharing best practices and sharing insights and policies and those sorts of things, excited to do that. And we as an organization, we're very open and transparent. And if folks have any questions or they want to see our policies, to use those policies or have questions, I'd love to make those available. Not sure how we can do that, Danny, but maybe just encouraging people to reach out to you or me.
Yeah.
And we can get whatever information we can out to folks to just help work as a community to persevere through, some very challenging times.
One thing we love about Sandstone is that you are there to help people. So when he says policies, procedures, things they've created, Marcello's been gracious enough to say he will share those with you if you don't have things and you don't have things written down to figure it out. So we appreciate you in this whole thing, putting this on, because I'm hosting this, but this was all Marcello's idea. He knows he needs to bring the minds together to just start talking and feel like we have community.
Yeah, thank you, Danny. Really appreciate it.
All right, so we are going to bring in Dr. Mike Barnes right now. So I'm going to go ahead and read off your bio real quick just so we can get to know you.
Sure.
Dr. Michael Barnes is a master's addiction counselor, licensed professional counselor, and diplomat in the American Academy of Experts in Traumatic Stress. He is a chief clinical officer at the Foundry Treatment Center in Steamboat Springs, Colorado. He provides administrative and clinical oversight for all residential and outpatient programs. Dr. Barnes comes to the Foundry after serving for 5 years as the clinical manager of residential services at CEDAR, the Center for Dependency, Addiction, and Rehabilitation at the University of Colorado Hospital, and 10 years as a full-time clinical professor in counseling. Most recently, he served as a clinical coordinator and clinical assistant professor in the MA program in counseling at the University of Colorado, Denver. Dr. Barnes has developed trauma-integrated clinical models for the treatment of individuals with co-occurring addiction and trauma, and he speaks nationally on families, trauma, and addictions. Dr. Barnes received his BA in psychology from Indiana University of Pennsylvania, his medical degree in rehabilitation counseling from the University of Pittsburgh, and his PhD in marriage and family therapy from Florida State University. That was a mouthful, but you earned it, right?
Yeah, the only correction is the MED is a master's in education, not a medical degree. So.
Okay, thank you for that. Yes.
Yeah, sure.
So we're happy to have you here today. We're happy to hear your input from a clinical standpoint, but why don't you talk about what you hope people will gain from today's town hall meeting?
Well, I have to say what I really love about this format is that we all kind of work in different areas, some more outpatient, some residential, some longer term, and that I think, people will kind of get a very broad kind of perspective on how this virus is impacting us, but also I'm really looking forward to hearing what the others are doing to deal with this. We're in the weeds ourselves at this point,
I love that. This is definitely community at its finest. And if you're watching to this point, we want to encourage you, if people aren't a part of the Sandstone Care page, share this so that other colleagues may hear this information that we have going on today. So thank you. We'll bring you back in a second, Dr. Barnes.
Okay.
Next up, we have Mr. Rourke Weaver. Are you possibly muted? You might need to unmute yourself, which was a very gentlemanly thing to do, but thank you. So we are going to, Rourke, I'm going to read off your bio real quick because you've got a long one and you've earned it as well.
Like, you can shorten it. Don't worry about reading the whole thing.
So Rourke is the executive director at Spiro Recovery Center. And before joining, Rourke spent the previous 3 years at Red Rock, where he did a lot as the director of business development. And when he was there, he transformed that newly created under-informed program into the most trusted programs in Colorado. 8 years before that, he was in the recovery services field with the Phoenix, where he ran programming, opened chapters in Colorado and both in Colorado and nationally, and led events and started his advocacy work. This experience led him to form a deep passion for the power of community and the necessity for greatest focus on building stronger bridges into recovery. Rourke's an advocate for treatment, recovery, and recovery support service. He has and continues to engage in a discussion around substance use disorder. Rourke is the Attorney General appointed co-chair of the Recover Ready Colorado Work Group, tasked with presenting the Recovery Strategic Plan for Colorado. He's a vice president of the Colorado Recovery Residencies, Colorado Professional Liaison Association Leadership Committee, and a member of the Colorado Providers Association. Yours is a mouthful. I did my best to keep it short, but we're happy to have you here today to ask questions as well. So, Rourke, what do you hope people really get out of today's virtual town hall meeting?
Yeah, I think more than anything, kind of dittoing what Dr. Barnes said of, I'm more looking forward to hearing what he's doing. Had somebody said a month ago that on top of everything of starting a new business, that you'd be dealing with a national or international pandemic and having to change the program within a week. I would have been a little shocked at that point. So this is new for everybody. We're all trying to do the best that we can. We've certainly been fortunate to be engaged in the conversation at a national level and seeing what everybody's doing. But we're all learning from each other. So more than anything, sharing what I have gathered so far, what we're doing at a state level, and then hearing what everyone else is doing.
Love it, Rourke. Thanks for being here today. We really appreciate you. So next up, we have Drew Powers, who wins the award of being the furthest away at the moment. You're in Maryland, correct?
Virginia, sorry.
You're in Virginia. So I'm going to introduce you and read your accolades real quick. So Drew is the Admissions and Business Development Manager at Sandstone Care, and a native of Northern Virginia. Andrew started his career in the behavioral health field just 1 year into his personal recovery and has been working in the field nearly a decade. Today, Andrew is dedicated to giving back to families, clients, and professionals struggling with substance use and co-occurring mental health disorders. Over the years, Andrew he's held a variety of positions, including certified substance abuse counselor, professional interventionist, and national outreach consultant. Drew currently works on the leadership team at Sandstone Care Treatment Center, supporting admissions and outreach efforts for the organization. So that's the most reading I'm going to do today. But Drew, we're happy to have your perspective and have you here. What do you expect to get out of today's virtual town hall meeting?
Yeah, thanks, Danny. I think, for us as an organization, it's really important to get perspectives from others that are looking at this and speaking out and on the front lines of adjusting, and also sharing what we've done so far, and being able to, as Marcello said, collaborate in a time of disconnection and really put ourselves out there for the industry at large and for prospective, families and clients as well, to know that, treatment for mental health and addictions isn't stopping. And so figuring out how to safely navigate that world right now and seek information and help right now is really paramount. So hopefully we're doing that today.
Awesome. Great. Well, thanks for being on here today, Drew. All right. So how this is going to work today is we are going to ask a question to one of our panelists. First is going to be Marcello. So get ready to hop in, Marcello. We're going to let Marcello answer this question, and then we're going to bring our panelist in to have a group discussion around this question. Look, I see we have a comment coming in. Duke Romley, thank you. So that's how we're going to start today. So first I'm going to bring in Marcello. So Marcello, we've got a question ready for you. So what can treatment centers do to keep their clients and staff safe?
Yeah, thank you, Danny. That's a very loaded question. It'll be a group effort, I think, and all the panelists trying to surface ideas around this. But I can say at Sandstone, we're kind of looking at this in a couple different ways: inpatient versus outpatient levels of care being handled a little bit differently, and then staff and clients, what we're doing to support both. Probably the biggest thing we do, and that a lot of organizations have done on the outpatient side, is just moving as many services as we can to being delivered virtually. And as Mark said, it had to happen really fast, so it was a little bit bumpy. We utilize Zoom. We were fortunate that Zoom is actually integrated into our EMR. We use Aliva. So Aliva is our EMR, and then we use Zoom is actually built into it. So that made it a little bit easier because our clinicians were pretty familiar with how to use Aliva. And so deploying telehealth out of there made it, I think maybe a little bit easier for us to implement. But all of our IOP and our OP services are now delivered almost exclusively via telehealth. So that's helping promote, social distancing and really limiting the amount of traffic that's coming into our offices.
Yeah.
PHP level of care, we have not been able to make that transition yet, really for two reasons. One is it's hard to deliver that. Like clinically, we want to make sure we can deliver that amount of programming well via telehealth. And then second to that is a lot of the insurance companies actually aren't allowing it to be delivered via telehealth yet, which has been a little bit of a struggle. And then, in terms of what we're still doing on site for clients at the outpatient centers, one thing that's tricky that I'd love to hear from some of the other panelists is how they're dealing with UAs in an outpatient setting. That's tricky. Right. We're still doing that largely on site. So we've created windows and people come in, and we've eliminated all visitors into our centers, and anyone who has to come in for special deliveries and or staff or clients, we actually do temperature checks. So they come to the door, we do a temperature check. If they're below 100.5, and then they answer a questionnaire that's more or less in alignment with what CDC is recommending in terms of, have you been to these areas, things specific to Colorado, have you been up in the mountains, Summit County, Gunnison, those areas have quarantine requirements. Have you been around anyone that has COVID? Those sorts of things. And as long as they pass the questionnaire and they do not have a temperature and don't have presenting symptoms, then they can come in and they still do their UAs on site. So from an outpatient standpoint, that was the biggest move from the client standpoint. For staff, it's really been a lot of policies around how to, one, just be very conservative with anyone who's not feeling well, right? I mean, one of the tough things with coronavirus and COVID-19 is that you can be asymptomatic for a pretty long period of time. And some of the symptoms like cough or sore throat are also like very common this time of year and can be, super, super benign, or it can mean, be a leading indicator to developing coronavirus. So how do you manage that when, your staff may have a couple of these symptoms? So we're very conservative where we can be in terms of staff working from home. Obviously, being telehealth has opened up opportunities to really support that. We've gotten some personal protective equipment for our staff. So, we were fortunate, and I'm happy to help as best I can anyone out there to source some of this stuff, because we were able to find different channels for it. But we were able to get some N95 masks, which are hard to come by. We've got lots of surgical masks, which is more routinely what we can use if there are risks, if staff maybe have symptoms, and it's important. We don't think it's COVID, but we want to be super conservative. We're having them wear a surgical mask in the office, for example, just to be, well ahead of it, and just, doing everything we can to still provide services, but not put our staff and clients at risk. And then on the inpatient side, it's pretty similar, but we haven't been able to lean on telehealth as much. So, at our medical detox center, it's really around our admissions protocols. So there's been changes across the board there, but there's a lot more screening at the pre-admission stage with clients, and making sure that, we're trying to get in front of any potential symptoms. Our staff is actually in the process now that a few weeks have passed. We're actually trying to, we're kind of operating on the assumption that this is going to continue to spread very quickly. And it's not if, it's when, like a COVID patient comes into our center. And so making sure we have lots of policies in place and isolation procedures and things like that, just to be able to be prepared. And then on the staff side, again, it's really about that protective equipment. It's in such short supply, so finding it and getting it is challenging. Hopefully that changes here in the coming weeks, but that's been, a lot of time has been spent by multiple different people to try to source that equipment. We were lucky, one of our colleagues was in India a couple weeks ago.
Oh, wow.
And he was able to get a bunch of supplies over there and bring it back and then ship it to us when he came home. He's based in Wisconsin. But just doing a lot to make sure, the team has the right equipment to be able to serve during this time, and just trying to, keep our services open and accessible and safe.
I love that. And we've already got some questions coming in that we will engage with. And Rourke, thank you for being behind the scenes, kind of answering, because that is a question that's right down your aisle. Because Duke asks, how do we plan on keeping alumni connected during this physical distancing? And I think that will definitely be a Rourke question. So stick around for him. All right. So now's the fun part where we get to bring in all of our panelists, and we get to talk about what their advantage, what they're doing during this time. So let's bring everybody back in. Welcome back, panelists. So can anybody kind of start and kind of take over where Marcello left off on what you're doing that's different than what he's doing?
I can jump in. I mean, our setting is very different. It's very rural. We're out on a big ranch out in, the kind of miles from anywhere. And so, so what we've actually done is put in like these sort of multiple layers of assessing someone before they ever get to our treatment facility. And so there's a private emergency room in Steamboat that does all of our medical assessments. So we can keep someone there for a longer period of time before they actually get to our facility. And not enough time to truly know. And Routt County is kind of not a mecca for testing at this point. So we're kind of, that's one of our big struggles, is knowing when it's safe to transition someone to our facility. The traditional questions, where they've been, those kinds of things. We have a lot of people in the community come in and do yoga classes and all kinds of other activities. So we've stopped all of those, and we have people on our own staff who have some of those skills. And so we've kind of made that, we're really limiting the number of people who leave and come in to our facility. A lot of education. I can talk about that kind of later, but we're doing all kinds of informing our staff of every change we can think of. So like masks and personal protective equipment is also part of kind of where we're going at this point. So those would be the biggest ones. It's interesting. We have not had anyone that we have sent for any kind of assessment, but we have it set up to be able to do telehealth. Like if our therapists, we want to limit some of their bringing things in from the community, where our therapists can actually do telehealth with our clients at the ranch. If someone is ill, they can actually do telehealth to participate in groups from our in-town residents, so we can begin to move people around that may be not feeling well into a more of an isolated situation while still participating in the program as they feel able to do that.
Love that. Any other panelists? What's been going on with you?
So I think you said my name, but it cut out a little bit. So coming from a more peer-based or recovery-centric organization, I think this creates a larger challenge in terms of not having a medical facility to be able to isolate individuals, and especially if there was an active individual or guest with COVID-19 or presenting symptoms of that, how do we address that? We've taken a certain approach. We're very fortunate with our organization that we actually have 2 buildings. So we have a building that was an old church that hasn't been zoned appropriately for our programming, but does, under its current zoning, provide for disaster housing. And so we're using that as our quarantine site, that if somebody was to present with symptoms, that we can quarantine those individuals. We've set up the space that it's comfortable, and trying to create it so that they weren't just, relegated to their room, but having a space where they can feel a little more freedom. So we approach it from the standpoint that if somebody was to admit, because we don't have telehealth, nor do we have a program that fits for an individual that would be able to join our programming from home. So they do have to be on site. So we, upon admit, the individual is asked to go to the church where we have the quarantine zone. We wash all their clothes. They're asked to take a shower. Prior to them coming in, we ask the questions of, have you traveled in the last 30 days out of this state now? We're keeping it to the state and not the country, but have you traveled outside of the state in the last 30 days? Have you been in any designated hotspots? That will most likely change as times continue, because the facts are is that we're all going to be in a hotspot soon. And so recognizing that it's very fluid, right? So the questions that we asked last week have changed to this week, but soreness of throat, any cough that's been developed, any signs and symptoms of a fever, and there is one more, and obviously, a cough, which I think I said. So yeah, temperature, cough, shortness of breath, or sore throat are the questions that we're asking previously to admitting somebody or giving them the green light to come up. And then daily, I'll just finish off by saying daily, we are checking individuals. They come in every morning. We take their temperature and ask them those 4 questions. If they answer 2 or more, we put them in isolation for 14 days and track that. And then they're allowed to come back into the house. Obviously, if anybody else presents, we have a space sufficient that we can hold a large group there. If, and we have to assume that it will, somebody was to become symptomatic, we will be closing and not taking any admits until we can safely say that no further, until 14 days after nobody else has developed symptoms. So for those who are operating sober living or recovery residencies, those are some resources as well. I'm sure there's other ones that I'm missing, but to keep it short, that's what we're doing.
Great value, Rourke. Really great value. And it's amazing to see the different ways you guys operate, and it requires a different procedure in every environment that we're hearing here today. Drew, what are you seeing?
Yeah, thanks, Danny. I think one of the things that, how we keep our clients and families and staff safe, the number one thing we can all do, which we're all talking about, is obviously preventing somebody with COVID-19 to show up at a facility, right? And so the practice of doing that is what's evolving most rapidly. To Rourke's point, we had screening questions a week ago about travel outside of the United States. Well, the United States is now reporting the most cases in the world.
Right.
So maybe we should be asking people, how often they're traveling in the United States, to Rourke's point, because this stuff is evolving very quickly. And so we're really trying to focus in on what happens when the person does show up at the facility and who's most vulnerable at that point. We're screening people that have potential immunocompromised conditions that, if they show up into one of our centers without COVID-19, but somebody else does have COVID-19, that they are now at a higher risk, whereas maybe most people would have mild symptoms. They might be in a more challenging position. And so we're adding in and layering in these other sorts of screening questions on the front end, not only to prevent the person with COVID-19 from showing up, but to prevent vulnerable populations from being in a environment right now that potentially could have COVID-19 at some point. And those are hard things to grapple with. Those are hard decisions to make. And those are hard conversations to have with families who are either sometimes not fully informed on what's going on in the country and in the world, but also really just in a state of crisis, trying to get their loved one into a treatment setting. And so we're really seeing a lot of challenges and a lot of tough conversations happening with families and clients. But ultimately, we're trying to keep everyone safe and not have to close our doors to the public, because that is a disservice, right? So I would just echo everything that everybody has said, and that the number one thing we can do is to prevent it. And then the secondary is, how do we deal with it once it's there?
Yeah, and Danny, really quick, just to weigh in on Dr. Barnes brought up a good point that testing is like the biggest problem because you can't get tested. We are seeing that's changing though, and just to put it out to the community, there's 2 labs that are testing now. Quest, we work with Quest. I don't know if you work with them up there, Dr. Barnes, but and I can get you in contact and be happy to put this gal's contact information out there, but they have testing now, and they have a 48-hour turnaround. What they're running out of supplies on is like the nasal swabs. You have to train your team to do the little swab test, but those are now getting in limited supply. So if there's ways to try to get access to those, Quest still actually, if you can perform the test with the swab, they're able to turn it around in about 48 hours. And then there's another lab that we found in Cincinnati, Ohio, called Gravity Labs. That are also doing 48 to 72 hour turnarounds on tests. And that's been really important for us, both for our staff, right, that have potential symptoms and you're not sure, is this COVID, is it not? And we've sent people to their primary, they don't have tests and they just say quarantine for 14 days. And, we're trying to operate and keep our services available, and having to wait that long can be very disruptive. But the testing looks like it's getting better. And those are 2 lab resources that we've come across that hopefully people can lean into a little bit to help with access and support.
Yeah, that's really helpful to have those 2 resources. Thanks.
Yeah, great. And anybody else watching either live or in the replay, please put your resources in the comments. There may be things that we still don't know about that you're finding. So please do put those in the comments. And we're going to engage with one of our first questions from Patricia. And Patricia says, have any of you seen a spike in intake or inquiry calls? And what is the mood and feeling of those who are calling for information? Why don't anybody that wants to take a first crack at that? Have we been seeing a spike, and what's the mood of the people who are calling in?
I can speak to that a little bit. Working with our admissions team, I think we're not seeing a spike. We're seeing a slight reduction, although not as much as I would have probably guessed on the front end of this.
Yeah.
I think there's a combination of people that are not wanting to seek treatment because of what's going on in COVID-19, that would normally be seeking treatment. And then there's also a group of people that are sort of rapidly trying to seek treatment in the wake of COVID-19, and families that are grappling with challenging dynamics at home that they haven't had to deal with in a while, that are going, oh, wow, there's a lot we want to work on now that we're spending an intense amount of time together. And so it's a mixture, right? It's sort of this new uncharted territory of the front end presentation of what causes a family member or a prospective client to call. I think the general mood and feeling of those that are calling with respect to COVID-19 that we've seen is one of concern, and one of, how are you going to keep us safe as the treatment provider during this pandemic? What are you going to do if there are, now we're obviously dealing with these requests and mandates to self-quarantine or stay indoors, but a lot of the questions last week were, what would you do if this happened while my loved one was in your sober living? How would you handle it? Is there food supplies in your houses? How long can you stay safe in one of your settings? And so I think generally people are concerned. They're asking good questions. We don't always have the best answers for them. We're doing our best to provide information to our admissions team so that we can disseminate that as quickly as possible to the callers. But generally speaking, I think the general population calling us is still trying to seek services, still trying to come in, still trying to get their loved ones in, and doing that as informed as they can to keep themselves safe and in our case, a lot of their children safe.
Totally. Anybody else want to chime in?
I mean, I think our calls are staying very steady. I think maybe we're seeing more viable calls in that people are really trying to get in, but I think our census is a little higher through this period than it has been, and people are staying kind of longer if possible. That's what we're seeing.
Great. Thanks for engaging with that. Rourke, do you have anything?
Yeah, I was just going to say that as the one issue that is coming up is finances in a very uncertain economic time. Obviously with the COVID concerns, there's fears. I think the only thing I could add is that obviously there's fears with the safety of the programming, but also in terms of finances and concerns around what the economic status is, people losing their jobs. Even job security, that a lot of questions that I'm fielding is, well, what are they going to do when they leave? Can they get a job? How are they going to get a job when they leave your care? And what's the aftercare plan? And so really being creative, I think it's kind of kicked us into high gear to figure out what are those industries and organizations that are still hiring. As one thing, as the economy suffers, there's also a boom and need and necessity for delivery drivers. Amazon, we have an Amazon warehouse in Denver. They need package deliveries, and grocery stores are hiring at an increased rate. So I think it's the responsibility of us to be really thoughtful as to what do we do after a treatment stay, and how do we set these individuals up with the best likelihood of long-term recovery. And giving them proper resources. So we are fielding a lot of questions, both around finances and around employment after the fact.
Fantastic. So we're going to move into the next topic, which is going to be more clinical. So I'm going to send most of you out. Dr. Barnes, we're going to have you stay with me.
Okay.
And then we'll bring everybody back for questioning after the fact. Let me get some stuff going on here, running a show. All right. So Dr. Barnes, you are up at Foundry Treatment in Steamboat Springs, and we've got a clinical question for you. So
Sure.
how has coronavirus impacted clinical services at the Foundry?
It's interesting. We were just talking about safety, and we were talking about medical and physical safety. And I think that it's always been my perspective that the more consistent that we can be in our clinical program, that things start on time, that the same groups that are projected allow clients to feel safe with the structure. And I think that's been, we've been really kind of wrestling with the ability to be consistent enough in our clinical model that creates that sense of safety for the clients, while making the necessary changes that are being imposed from the virus on us in that process of, so groups may not be in the same group room because we're doing social distancing. So we have a bigger group room and kind of dividing groups a little bit. So it's really been more, the biggest impact has been on sort of the balancing act of making sure that we're kind of living within the requirements of physical safety while maintaining the consistency of emotional safety. And I think we've done a pretty good job of that. Our clinical program is very, very consistent. The other thing I will say is, we can't give clients what we don't have.
Right.
And so if we have in a really trauma integrated treatment model, it requires our staff to be able to be kind of okay, grounded, able to kind of manage their own autonomic nervous systems. And I think that's the other big challenge. And I would love to hear how the other guys are kind of experiencing this as well. But, as our staff are dealing with, the potential risk of, being infected when they may have family members that are part of that high risk group or children. And as they're bringing things from home into work, the ability of really trying to provide them with enough support to where it's not interfering with the clinical model.
Love that. Love that. So if it's okay with you, we'll bring in our panelist.
Sure.
All right. Okay, panelists. What about you guys? How is this affecting clinical services?
I'll chime in, Danny.
Yeah, please do.
And I completely agree with what Dr. Barnes was saying, especially right now, investing in our team is like the focus, right? If we can't keep our team well and safe and, motivated and excited to do what they love to do and they're so passionate about every day, then, the quality of our services will diminish and that'll have a trickle down effect. But it's impacting clinical services in different ways at different places. The telehealth transition has been hard, right? That normally is something, we wanted to do more and more telehealth as an organization, and we did it in very select circumstances historically. And, forcing that move in a week, didn't allow us to do it with as much grace as we might have otherwise been able to. So investing a lot in our team around just how to deliver telehealth services at the highest possible level, creating forums for our team to collaborate with each other and share best practices. We've actually created, we have multiple locations. So we have like a centralized little, we call it the COVID command center, where Liam Grafton on our team is there, and he actually joins all of the telehealth sessions that are going at any given time, and he's able to see trends, and if there's issues or technology issues, there's a line that clients and families and staff can call right into to get him. And we try to just create forums where we can share our struggles and what's working and what's not, and share those best practices across the team so we can make the services better. Because I think the transition, we did the best we could, and I think scoring us in terms of how we're delivering those telehealth services, I think we're doing the best we can, but I think there's plenty of room just given the fact that we had to move it so quickly. I think for staff self-care, we did take advantage of, we've been considering as an organization working with an employee assisted program, and we actually used this time to just push that through. So we actually engaged Minds and Associates, actually local here in Colorado. We rolled that out actually last week and into this week, just providing a resource to staff, because it is very stressful on so many different levels. Being a human being right now in this world is hard. And so, we were able to put their services out, and I was shocked at how reasonable it is. I mean, it's very inexpensive. We have 150 employees, and it was a few $1,000s for the whole organization for the year. So it's something that organizations, it's not cost prohibitive. And it seems, the team was very, very excited about that. And then another quick thing to put out is Headspace, which is a meditation app. They actually just, within the last few days, opened up, and they're offering free Headspace subscriptions to all mental health professionals. I think you just have to enter your MPI number. So it's just something to put out there to anyone in the mental health world, you have to have an MPI number. That's kind of how they're controlling it. But as long as you have an MPI number, you can get a free subscription. I think it's through the end of this year, which is great. So we've been encouraging our staff to practice their mindfulness as well, because it's a lot right now.
Very cool. So we have something we're going to do. So Jennifer, I see your comment. I'm going to get to it. I want to let you know that. Thank you for engaging with us. We will do that question, but we have something we're going to do because we want this to be a town hall setting. So we actually have somebody to hop on to ask the group a video question. So I'm going to hop you guys out. We're going to have our video question asked, and then we'll bring you guys back in to answer this question. So I'll see you in a second. All right. So welcome, Darren. We have Darren Miller with Red Rock Recovery Center. Darren, why don't you go ahead and introduce yourself, what you do, and then ask a question to our panelists.
Yeah, so my name's Darren Miller. I'm the clinical director over at Red Rock Recovery Center. So sharing a lot of the sentiments of the gentlemen of the panel. And a quick question and something that I've been ruminating on and talking over with my staff is, what are the positives that everyone sees coming out of this on the other end? How do we think that this will shape the mental health and behavioral health services that we provide in a positive way?
Fantastic question. We're going to bring our panelist in. Thanks for joining us, Darren, but I'm going to send you out and have our panelists answer that question. Thank you. All right, panelists. So what a fantastic question from Darren. What are the positives?
I mean, I can say our guys are so aware, and they speak so freely about it. I know that if I was out in the community right now, I'd be really using it at a very high rate. And it's really interesting to watch the guys begin to process what's going on outside of the program and the reality to their families and such, and how really making very significant connections between that level of stress, that level of threat, and their use. So that's one thing that we're seeing that we didn't expect to see at all. With that, they'd be more anxious. Our staff's actually more anxious than our clients, it seems.
Yeah, I think that, Darren, thanks for the question, man. And I think that is one thing that we've been really trying to emphasize within our team and to our guests as well, and to our kind of greater community of Sparrow, is really kind of seeing what's the positives, like how do we accept the situation that we're in and look at what the bright side of the things are. And we've largely turned that over to the guests. And so we've given some options, and they're asking. We've done some, the wonderful thing about the recovery community is how interconnected it is. We're doing meetings. All of our meetings have gone online. We don't have anybody coming in, but the upshot to that is we get to do meetings in Ireland. We get to do meetings in New York and California. And these guys are getting to be connected to people across the country and across the globe that we've never even thought was possible. Additionally, is looking at the kind of positives in all this of, there are a lot of people right now who don't have anybody else around, and they're just in their house and they're isolated, and we get to be with each other and we get to be supporting each other through this hard time. And the guys were, the crew that we've seen just kind of come together when we take this kind of scary situation and really trying to take as much of the fear out of it, not taking the severity out of it, but taking the fear and saying, look, we have this situation and fear can control us, or we can look at this as an opportunity to grow and say, what is the good that can come from this? How can we be creative and come up with solutions to see what the positive is? And they came up with the solution of, like, we want to have meetings in Ireland. We want to go and see folks in Scotland. I luckily have a few buddies out there. So they've been the interconnection of recovery is just getting so tight right now. There is a lot of opportunity and a lot of some excitement stuff or exciting things happening for our guys right now.
That's awesome. I was just going to add quickly, and thanks, Darren, for the question and taking that approach with a question. I think it's really easy to focus on negatives right now or fear-based questioning, and how we stay positive is going to be a component to this going on, probably for the foreseeable future. But one of the things that for us, I think at Sandstone, at least, and a lot of providers, this is really forced the hand of virtual services being delivered, right? I mean, we essentially overnight turned on virtual IOP to be delivered, and that has increased the accessibility to people that historically have not been able to get those services. For example, we had a client who was looking at stepping down from residential treatment, teen residential treatment in Colorado, going back to a very remote area that otherwise their discharge plan would very likely be individual therapy without any intensive outpatient or partial hospitalization programming available to them, regardless of what they wanted to do. And now we have a virtual service that they can attend. And that's something that is a completely new access point for somebody in those situations. So we're actually broadening access, and not to say that virtual IOP precedes in-person IOP or anything like that, but knowing that is valuable to that family that wouldn't otherwise get services is a huge data point for the organization.
Love that. And before we continue too, I want to say we're getting a little tiny bit of feedback with reverberation. So if you're not talking, just go ahead and mute your mic and we'll just move that way forward. So great question, Darren. And we are going to engage with our community because that's what we said we wanted to do. And we have Jennifer Place who asked a question and we're going to utilize it during this group chat. And that question is, how are you working with MAT providers to ensure continuity of care for patients, clients utilizing that tool? So who wants to take the first crack at this question? Go ahead, Rick.
Yeah, just as, and thanks, Jennifer, as a recovery organization and a peer-based program that supports MAT as a pathway to recovery. This was a really important question for us to answer immediately, is how do we support MAT in a time where we're not able to get out as much. And so we found a local MAT provider through Urban Peaks, who has been working creatively with us through Telehealth and his own doctor's portal to be able to continue to write those scripts that individuals in recovery who need those services have access to on a weekly basis. So once a week, we log in, we send a list over of individuals who want to meet with the doctor. The doctor is able to sit down with each person individually and is able to prescribe those meds, those incredibly necessary meds for that pathway. So that's kind of how we're taking that.
Anybody have a different approach? Okay, good. Thanks for that. Thanks for that, Rourke. So we are going to let Rourke stick around, and Rourke, we're going to ask you a question. So we'll see the rest of our panelists back very shortly. So let me get this. Okay, Rourke, as we know, and most of us that know you are incredibly connected in the recovery community. You do a bunch all over our state. So how do we combat isolation right now in the recovery communities? What are organizations doing to combat that isolation? It's a big deal right now.
Absolutely. Yeah, I mean, it's, it's really hard. It's hard to watch, especially with the connection that we've created. We were sitting down, the community that we have up here, we call guests. The guests were sitting in a meeting, and one of the individuals who joined us was reporting that they were alone in their house and they just lost their job. And the challenge that presents, but I really want to come at that question in a positive light as well, and say the love that poured out of that meeting and the support that came from that meeting was moving, to say the least. And I think one thing that I could say about our recovery community is, especially the recovery community, is that we've been through the crucible. We have an ability to adapt quickly. Our own personal journeys have built us for these situations. And one of the messages that we're trying to pass down to our guests, and hopefully our guests to the larger community of recovery as a whole, is we're ready made for something like this. Like, we will adapt. And the moment that even the thought of isolation was coming out, I saw my news feed on both my Facebook or social media was just covered with Zoom meetings.
It really was. The community did respond quickly with that.
and we react. We have an ability to recognize the problem and come up with meaningful solutions quickly. And so, not to come at it from a negative, but more from the positive, what I would say is, like, I've been just overwhelmed and incredibly impressed with the reaction the recovery community has had towards adopting new policies, adopting, Zoom meetings where historically it has been in person. And just overnight, we are transitioning to online meetings and online community groups. I know that Duke Rumley posted and the recovery support services are all being creative. Sober AF is doing a virtual what is it?
Safe Music Festival.
Yeah, so a virtual music festival. The Phoenix is hosting all of their programming online and doing town halls once a week with Scott Strode. I know that the AFR and I'm sure YPR and Rod Rushing's Embark are doing all recovery meetings. Like, the recovery community is exploding right now to create opportunities for individuals to find support in what is really a scary time for I think a lot of people, but coming at it from a place of, again, you're going to hear me say this a lot today, is not coming at it from an approach of fear, but one of support and excitement, and saying, we understand that fear. We feel that fear too, but we're not going to let that crush us. We're going to be here for each other in this time. And so, in terms of resources, just I'll go real quick through it again. AFR, Advocates for Recovery, Young People in Recovery, Embark are all hosting all recovery meetings, multiple pathway approach recovery meetings. The 12-step community is absolutely on fire. I have a list of over 200 meetings that are happening every week that we are just kind of like sifting through and saying, what feels good tonight?
Right.
And the Phoenix as well is doing all their programming. So even for those residential programs, those programs who are doing telehealth, a great resource. So if you guys are getting a little bored inside and you get a little stir crazy, check out the Phoenix, and they're doing workouts every day. They're doing introductory clinics on how to clean a mountain bike. I mean, it just is incredible to see what's happening right now.
For anybody that doesn't know the Phoenix, you're the best to tell people who it is. Do a quick elevator pitch on what it is.
1 second. So Phoenix is a nonprofit that is they believe in an active lifestyle and a recovery community. So all their programming is largely based around building community. And they do that a lot of times through activities such as yoga, rock climbing, strength and conditioning, and outdoor sports as well. But they're not just for that, they're community as well. So they're hosting all community meetings. So individuals who are just looking for support or just trying to find something new, it's a great resource to check out something maybe you didn't know before. So quick download on the Phoenix.
Yeah. And for anybody watching again, live or in the replay, if you know a resource that worked, didn't comment on, please put it below in the comments so that somebody may see that, interact with that, and find that good fit for them. So we're going to go ahead and bring back our guest panelists really quickly. And so what about you guys when it comes to isolation and recovery communities? What's happening in your organizations to support people in this time of isolation? Who wants to take a first crack?
So it's interesting, in residential treatment, they have lots of opportunity to mingle with their kind of co-clients that are in the facility, but we use a model called NARM, Neuroaffective Relational Model, and it really kind of focuses on connecting and trusting, and so we've really had to do a lot of work with the online meetings to get people to engage more. And so one of the things I'm curious about is, what is 12-step meeting kind of the culture going to look like on the other side of this? And there's an interesting article in Politico about what is our culture going to look like on the other side of this, and how many more people are we just really building an infrastructure for that kind of connection for the future that we may not go back to the way it was. And so that's one of the things we're really looking at as an organization is, how is technology going to look how's residential treatment going to look, a year from now, 2 years from now?
Right. Right. Fantastic information. Anybody else want to take a crack or move on?
I was just going to say, I think one of the things that we're doing as an organization is we're creating avenues internally to share information really rapidly. So obviously one of the things that is top priority is the fight against cabin fever, right? We have a chat with a lot of department heads and the folks on the housing team that are working with our clients that we have in our 3 recovery living residences, throwing out ideas, throwing out, virtual yoga platforms, throwing out, ways to get involved in advocacy in the recovery community, and just really sparking, hopefully, an innovative way to connect and interests that maybe otherwise would be overlooked at a time where distraction is maybe more plentiful out in the real world, right? And we have a lot of time on our hands now to really invest in introspective thinking and looking at what do folks want to do, how do they want to spend their time, and so everything from exploring ways that we can connect all of our clients, that are in sober living together with each other and outward, right, in ways that just are unique and different than what we've done. And we do that all through our internal company social media that we use. And any company that's trying to still do this all through Outlook and things like that, I tip my hat to you. We really, for us, we're blessed that we've been using some great technology for a long time that allows us to connect really well as an organization, stay connected so that all can flow down to our clients and the recovery community, and having that all get surfaced really quickly, as it's hard to get information right now. Obviously, the news isn't reporting on how to stay connected in your recovery circles, right? So it's really about that getting back to kind of the roots and like Rourke's saying, folks that are in recovery, being able to bring that to the organization. That would be invaluable. If your organization doesn't have folks that are in recovery, let us know, and we can try and get you guys plugged into some of those different virtual settings and communities right now.
Great. So we have a question from the audience that I think is a great segue because it has to do with telehealth. And Brian Tierney asks, how do you think COVID-19 impacts the use of telehealth services within our industry moving forward? So as we know now, we're forced to use these services. We have no choice. But what do you guys see from opening up this box of possibilities? How is this going to affect your businesses moving forward?
I'll take a swing at that one.
Yeah.
So I think Drew may have hit on it a little bit, but access will be far greater, which is a really big benefit, right? So folks in rural communities, maybe with difficult schedules or, a variety of reasons that make accessing in-person services very challenging, I think that will be diminished. Before all this, I could probably count on one hand how many providers had nationally a true virtual IOP program. And now, most providers are doing everything virtually. So I would imagine that those services will remain available indefinitely in a much larger way, which will be helpful for folks looking to access services. I think the dilemma is going to be more how you think about the quality of like telehealth versus in-person, or when would you really strive to encourage in-person services over telehealth services, because that in-person interaction is really important for us working with teens and young adults. Like, we see a lot of kiddos that have gaming, addictions and process addictions, and they're on the screens all day already as it is. And so, and they're comfortable interacting like this, but you put them in front of someone and they can barely interact at all. And so, for us, it's going to be more how to make sure that, those that need the in-person services are really engaging in those services when appropriate, I think is something that's already starting to roll around in our minds as an organization.
Yeah. And other than a rural footprint and being able to reach more people, do you guys see any other changes with that in the future? We had a question on here that had talked about can telehealth be provided for all levels of care? So is this going to be something where telehealth is going to be used for all levels of care moving forward? Rourke?
No, that was just fingers crossed. I hope so. I think that there's this we can see this as an opportunity for those folks who are in rural communities who don't have access to the services that we get in metropolitan areas. And I hope that we can get to a place where those people or any people who don't have access to services, we can use this platform to reach those individuals. I will say on the recovery side of things as well, that, I hope that we do this as well. This is something that's been a bit of an eye-opening experience, just to see the lights come on for folks who work in, folks who are a part of a treatment community, really showing them how broad the world is and how many people are in recovery, and just anybody, or just the diversity in recovery that we do have. We can access these meetings, and I hope that they continue, because it's really cool to see, no matter where I go, there's recovery. So this is, we've used that tool in that way to show just how wide and how powerful and impactful recovery is internationally.
Yeah.
I mean, I think that I was watching the video that you did with I can't remember her name, the psychologist earlier today.
Dr. Helene Simons.
About telehealth. And it was pretty fascinating. And one of the big issues is practicing across state lines. And her comment that that there's a big movement to kind of have states begin to allow that practice of moving and practicing across state lines. I don't know about residential treatment, but I think we're going to see as generations that are coming now have had internet all their lives, I think they're really far more comfortable in this environment than my generation would be in a therapy setting. And as therapists are required to do it for maybe gosh knows how long this is going to last. Right. I think a lot of people are going to get very comfortable with it. And I don't think we're going to go back to the way we were in many cases.
Yeah, and I just would piggyback on that. Dr. Barnes was just saying, I think, the industry should see, and I hope we see an investment in how to make this better. While this is cool and we can sit here and talk on Facebook Live and we have Zoom meetings with our clinicians and things, there's a lot left to be desired that does make it different from those in-person interactions. And so, we have the technology of, whether it's VR or ways to really immerse the digital user into what could feel like a very real group interaction. And our clinicians right now are grappling with the challenges of facilitating a group virtually and how you do that well. And I think technology is the key to unlock that difference of if we end up in a place where virtual interactions become, whether it's the same amount as or more than in-person interactions in this space, at least at the outpatient level, we'll need technology to catch up a little bit with what we can provide. But I do think, just going back to one of those questions about will all levels of care be virtual, I'm not sure that certain things would work virtually. I mean, our medical detox doesn't have any intent on becoming virtual, for example. We have certain ways that we can quarantine and provide services virtually in there. If we had somebody that was active with COVID that we needed to keep into a quarantined room that we could communicate with and provide services to virtually, but we still plan to deliver that with our nurses and doctors on site with the patients. And so there's probably I think going to be an increase. I'm not sure that we'll ultimately wipe it out entirely. And I hope we don't, because I think there is a tremendous value to Marcella's point of, when appropriate, using those in-person services.
Love that.
Can I just say one other thing?
Yeah, please do.
So I was talking to someone from Hazleton who has a completely online IOP at this point, and I was amazed at how they do so many different things, and like programs like Trust But Verify, that when a person walks, they have every AA meeting in the country with a spot in the middle of the room where they can assess someone coming into the meeting and leaving the meeting. that it's not just this part of the technology that's going to change what we do, but some of the apps and some of the other technology that really allows programs to do monitoring, scheduling urinalysis, those kinds of things that you just don't have to see them in the office.
Yeah, that's very true. That's very true. So let's move into another question. And I do believe we're going to ask Marcello a question. Drew, did I skip a question for you, or did I ask you a pointed question?
No, you haven't asked me a one-on-one question.
Then let's do a one-on-one with Drew. Sorry, there's a lot of moving parts. We're going to bring Drew in for a one-on-one, and then I'll bring the rest of you guys back. Sorry about that, man.
No worries.
Managing a lot of little things get messed up. So from your perspective, let's see, what are best that we haven't talked about? This is cool. So what specific adjustments have you made to the admissions process at Standstone Care to ensure that clients and staff are safe? We talked about this a lot, but maybe if you can talk kind of what the families are going through, and from that perspective, when they're asking questions like, how are you changing that around now?
Yeah, we alluded to some of that. I think the biggest thing I think everybody's doing is screening to prevent somebody with COVID coming to a facility, and ultimately that is the number one thing that we can do to keep our facilities and our staff and our clients safe. And admissions really carries the baton there. And so we've been, from the very beginning of this, developing screening questions that are the first thing that the team sees when they're working on their profile in our CRM system. And so, and those have been updated very frequently with the latest information from the CDC and the World Health Organization, as well as some of our own state, both Maryland and Colorado, where we operate, any state-specific concerns that we need to have, and also just our own general company's insights with our medical team, figuring out ways that we can eliminate risk. And so I spoke a little bit about, for example, at our Cascade Center, which is a teen residential program, we know that right now children, for the most part, are not showing symptoms the same way as some older adults are. And that's changing, but we do see that a lot of children are asymptomatic. And so we're trying to figure out how we would deal with potentially a population of folks that are asymptomatic but positive for COVID by limiting high risk individuals from entering the facility right now that could have other chronic medical issues, specifically medical issues that are suppressing the immune system, and we're screening specifically for those. So they're not all barriers to entry. They're just being screened at a much higher level by our medical team. We're really trying hard not to deny access to individuals for any reason. We don't want to just blanketly say, sorry, we can't help you, because ultimately the question there is then, well, where do they go? So we're really trying to assess, maybe somebody that was appropriate for PHP that needs to come in person. We can talk about virtual services with that might have a co-occurring a medical condition to make them higher risk. And we talk with our clinicians and our team about if that's appropriate, but when possible, limiting that risk for those specific individuals. So just really trying to stay on front of all of those screening questions to prevent risk. In addition, we're talking about this almost every time we're on the phone now. Right. So it's not, it's something that we're talking about with families and clients a lot, and we need to keep our messaging consistent. And that's really hard, right? And it's the same thing that I think Dr. Barnes was talking about earlier. It's just our clinicians can't give something to our clients that they don't have. And same thing is true of our admissions team, right? If we need our admissions team to be just as confident in our services and what we're doing to combat COVID-19, and when we're talking with the families, because they need to be reassured by us. They need to know that we are operating from a level head and that we're taking the right steps and the responsible steps and being very careful not to give a lot of energy to perhaps things that are not as well researched or could be more fringe information right now. And that's really hard to do because families are reading everything. They're calling us with lots of questions about many different aspects of COVID-19. And so really trying to keep a calm and collected, centered approach to providing reassurance to families and providing them with a transparent look at how we're handling this, and also saying sometimes we don't have all the answers you might be looking for, but odds are if we don't, probably most people don't either. And so let's figure out how we can support you with what you're looking to accomplish right now.
That's a fantastic approach, and I hope you and the audience are learning from this process, especially from the admission side of things, to make sure your families and your staff and everybody, we need to ensure their safety during this time. So I'm going to bring the panelists back. We do have somebody in the lobby, so just hang out there. We'll bring on for another guest question. But as this admission process, is there anybody else that has anything differently they're doing? I know we touched on this a lot as we've been talking, but any other additions to that question? I think we've hit it pretty hard. Definitely. All right. So we have a question that we're going to bring in. So I'm going to send you guys all back and we will do a town hall question really quickly. So we have, go ahead and unmute yourself. We have Duke Rumley with Sober AF Entertainment. So
Hey,
go
Danny.
ahead and introduce yourself, what you do, and what's your question for our panelists today?
Great. So Duke Rumley, Executive Director of Sober AF Entertainment. We create safe spaces and fun places. And for the last 2 years, we've hosted 62 events at music festivals, concerts, and sporting events. And now that we've all gone virtual, we are creating a virtual music festival May 7th through the 10th. But my question is, how, in this time of physical distancing, do we keep people emotionally connected? And how do you, support alumni through this? And how do you keep people open-minded to virtual meetings since they're so new, but we know how important they are, especially the first couple of months out of treatment? They have a pretty intense experience. And then how do you keep them spiritually charged till they have some type of change in their thinking and actions?
Awesome. We appreciate your question, Duke. You're
Sure.
awesome. I'm going to head you out and bring our panelists back in to talk about that. Thank you. All right, panelists, you're coming back. So it's a very good question. It's a left shoe for some people, putting it on the wrong foot with these virtual meetings. And, any advice for how to, emotionally connect to this process? There is something to be said about a human interaction, a face-to-face interaction. What advice do you have as far as connecting from a distance here? How about you, Rourke?
Yeah, I mean, I think that, I would throw that back to you, Duke, as well, and say that it's the responsibility of all of us to really work together collaboratively to be as creative as possible to come up with what solutions. I think it's a wonderful idea, the online music festival. Trying to be as diverse as our community is diverse. We represent all walks of life. And so trying to have only one option for our recovery communities and trying to fit a square peg into a round hole, you're not going to get a whole lot of wins there. So really working collaboratively, I think it's the onus of the treatment providers as we have resources that we can pull from to engage with the recovery communities who are often operating on the fringes and just trying to do the good work, to reach out and ask them for help, to say that we're interested in the services that they're providing, to engage with them regular and often and say, this is the feedback that we're getting. And then there's onus on us to really look at hearing from our people. At least, for us, we think that it's really important to get the language of the community and see what they're saying. I've said it a lot already, but we were getting a little burned out on all the Zoom everything. So one of the ways that we kind of approached that was, what would be fun. And through that conversation, we really came to that. Well, let's look at international meetings, and let's look at all recovery meetings, and let's look at diversity. And we can have young people meeting now. We're in Evergreen. There's not a whole lot of young people around here. So just, really showing that, I guess the point being is really working collaboratively with your community and saying, what are the things that are struggles for you and how can we turn those around? And then using that information and reaching out to the recovery community at large to say, hey, this is what we're hearing, and get the feedback that's out there. There is, it's incredible. In 2 weeks, there's just about anything you would ever want online now. We just got to search for it a little bit. We got to put in the energy to find it.
Love that.
This is kind of what I was talking about earlier when I was talking about that NARM model where connection is so important. Is now, guys are being pushed into, these are some local people who sponsor. We can't meet with them in person, but you can meet with them online and begin that process. And I'm always amazed how many people are having coffee, sitting, talking to friends.
Yeah,
you can connect this way just actually as well, really.
Sure.
Not as well, but we're going to learn how to do that eventually.
It's embracing the newness and understanding that this is what you need to do. There's no other options. Any other? Then we will hop into one of our final questions, which I think is going to be a good one for the team. And I'm going to ask you to stick around for this, Marcello. But this is one I'm going to throw at you, which is, what does the future hold? So what are you anticipating over the coming weeks and months in this COVID-19 pandemic? If you can look into your magic ball, what are you anticipating is going to happen?
Yeah, unfortunately, there is no magic ball. I think we're just trying to get comfortable. There's a lot of, things are moving very quickly, as we've said multiple times. And I think there's some views that this is just going to kind of come and pass. And I think we're kind of looking at it from the standpoint that this probably is like a new normal for quite some time. And, the reality is, they're just relaxing all the quarantine stuff over in Asia and in China. And so we're kind of, that's going to be a pretty important data point to see how that goes in terms of whether or not, on the back end of our quarantine, are we really going to be on the other side or are we not? But we're kind of trying to set expectations with our team and with our clients and families that, that this probably isn't just going to be a short-term thing. And if it ends up being, that's great. But just trying to get grounded those expectations so that there's not a lot of frustration or confusion or concern if it doesn't turn out or if it turns out to take a lot more time. We're kind of focusing on, and most people are, it's just until there's a vaccine for COVID-19 and until it's widely available, it's going to be, unfortunately out there. And, hopefully there's some seasonal benefits and things like that maybe mute it to a certain extent. But I think the big thing for us is just setting expectations that this is probably kind of a near medium term new normal. And let's do the best we can to, deliver the best services possible in the most accessible way, and doing so in a way to keep our clients and staff safe.
Yeah. Do you see this as being more of like a disaster preparedness thing in the future? So now we're going to be ready for this to send people home. If this were to happen again, because there's those reports of, could this come back up in the colder months? It disappears in the summer, comes back in the colder months. From a business standpoint, like being ready for disasters, is this like right up there now on how we're going to do this if in October we get round 2 of this?
Yeah, I think definitely it's much more top of mind. And I think, a lot of organizations are just naturally more prepared because we've had to weather it to this point already.
Yeah.
So I think most definitely it's a consideration. I think it's forced us to make a lot of changes. Our infectious disease protocols, were always very important. But, now we're operating at standards that are many orders of magnitude beyond what we were initially. And I would imagine some of that
Right.
probably won't ever get relaxed again. Some will, but many components may not. So I think, generally speaking, I think most organizations will probably be thinking about quote unquote pandemic risk, if you will,
Right.
because this has just happened.
I get that. Okay, so let's bring our panelists back in and get their thoughts and opinions on this. So panelists, what do you see in the coming months, weeks, years? What do you see that this is going to create?
I think in the coming months, like right now, we are having to recognize it's not a if, it's a when somebody becomes symptomatic in our houses or in our programming, and preparing for that. So what does that mean for us, especially and for those organizations? And honestly, I'm going to just throw everybody. I think everybody is concerned financially. This is going to have a significant impact financially in our programs, and certainly for us as a startup. This is a big scare for us. So how do we get creative and recognize that if somebody was to become symptomatic, that will likely shut down the house for the bare minimum of 2 weeks, and that's like best case scenario. So we need to prepare for the worst case scenario and really looking at how do we address this problem with creativity and not fear, and looking at, all right, well, what options are available to us? What's going on? There's a lot of great resources out. ASAM is actually doing a training right now on practices around, I'm sorry if you're listening to us, but ASAM is going to be, and I'm sure it'll be accessible afterwards, but they're doing a training on best policies and procedures around COVID-19. So I guess before I get too off track, the point would be is that we are preparing for the next couple weeks, probably up until June, for what will most likely be the worst of the situation.
Yeah.
How do we build in fail safes? SBA loans are out right now. They just released it last week in Colorado. You will have to check your county to see if those are available in your county. But as a worst case scenario, there are small business loans that are being made available. There is disaster funding for those organizations who are online listening to this, who may be a nonprofit. Foundations and government agencies are releasing emergency funds that you can apply to and that may be available to you as well. And even those for-profits, there are some organizations that are releasing fundings to help folks stay open. We are looking at one right now that is a government loan that if there are no layoffs, the debt is forgiven. So there are resources out there for those organizations who are really scared financially how we're going to make it through this. There are resources out there, and what I would say, kind of as a final thought, is we're all in this together. There's no doubt that one thing I'm incredibly proud of, especially here in Colorado in this industry, is that we all do this together. And not just an hour ago, I saw a big thank you from one program, one provider to another provider for opening up some resources that they had and some equipment that they had and sharing those things. Like, we have an opportunity to all get through this together, and we just need to support each other in that. I think in the long term, like what Marcello said is very important. We will see a slowing down in the summer times, but we have to be prepared for when the weather changes, when it cools down, when the situation is ripe for this virus to come back, that we will see another boom. So we're trying to think long term and short term. In how do we prepare for this until hopefully a vaccine comes out in the next year and a half, and or testing becomes much more readily available.
Yeah, really great points, Roy. Any other panelists about upcoming changes? Dr. Barnes.
The thing that I think about is that as we weather this storm and staff works harder and harder, longer and longer, that we may actually see a lot more compassion fatigue on the other side of this issue rather than during the issue as people kind of do their jobs. So I think that's one of the things that I'm kind of looking forward to, is to say, like, really keep a close watch on staff's well-being. And
valid point.
So,
yeah. Anything from you, Drew?
I was just going to say, I hope, just kind of going back to some of the positives too, that I hope through this, there's a lot of different segments of industry that are needing to adapt right now. And, the payers are doing things to try and make, whether it's virtual services more accessible and looking at adjusting regulations. I really hope that the folks that have, the payers in particular, take a look at what's going on right now and help the addiction treatment industry to continue providing services for folks and reducing barriers. We've just seen such a tightening of criteria for services in this industry, specifically in the last few years. And I really hope that this is a sort of a time to reflect for folks and think about how we can make it easier on the individual seeking treatment rather than harder. And this is a pandemic is most certainly among some of the top reasons to make something globally more difficult to go out and get. And I hope that we all come together and look at ways that we can increase obviously the quality of what we're providing to folks, whether it's through technology and innovative ideas, but also increasing access. And that's going to be critical, as I think Dr. Barnes spoke to earlier, that the mental health of our communities and our folks that we serve probably deteriorate to some extent during this crisis. For how long, we don't know, but we can't have access be an issue. We'll have centers that are closing. We'll have centers that are closing their doors for periods of time and centers that are closing their doors indefinitely. And coming together to support the need in this space is probably more important than ever. And I hope that is something that sticks on the other side of all of this, irregardless of how this all shakes out, how long it lasts. I hope it's over next week. I don't have any high hopes. I wouldn't be betting on that right now, but I hope we can see the other side of this and get back to normal, but with a lot of resiliency and new strengths and new tools that we didn't have before.
Fantastic. So can we as a group just give our panelists a big round of applause, hearts and thumbs, show them how much you appreciate them taking time out of their busy days to add value and have a very focused conversation on what's happening during this pandemic and being very transparent about what's happening at their individual treatments facilities. So we want to thank all of you, the panelists, for taking time today, for adding value and being a resource for our community. I think I can speak for all of you when I say if anybody wants to have a one-on-one conversation, they're more than willing to reach out and talk to you if they need some resources. Could you all agree to that?
Absolutely.
Fantastic.
100%.
Fantastic. So again, thank you, panelists, for your time. Thank you for everybody who was with us today live. And if you're in the replay and you end up putting a comment below, just tag one of our panelists. And panelists, I ask that you just maybe respond to comments over the next 3, 4, 5 days if people have questions or concerns. So again, appreciate your time today, panelists, and enjoy the rest of your Friday.
Thanks, Danny.
Thanks, Danny.
Thanks, y'all. Thanks
Bye-bye.
for doing this.